Prevention for the colon is normally recommended over the age of 45. But there are certain risk factors. So there's family diseases, there is history in the family of colon cancer, there is typical signs where colon diseases can be diagnosed, for example, passing stools with blood or frequent diarrhea or severe constipation. So in those cases, preventive colonoscopy is indicated. Yes, colon polyps are tumors, benign tumors rising from the mucosa of the colon. So there is something what we call an adenoma-carcinoma sequence, means most of the cancers of the colon develop out of polyps, let's say more than 90%. This is a slow process over many months or even years. If you can diagnose the tumor at the stage of an adenoma, which means a polyp, a benign tumor, then it's quite easy to snare this polyp off when it is still benign. So this polypectomy can be performed during an endoscopy, during the colonoscopy. Usually we inject a little water or substance to stop bleeding in the mucosa to take it off the wall of the colon, and then with a snare, an electric snare, it is cut off. The polyp is very important to be sent to the histopathology department to see whether this polyp is still benign or on the way to form a cancer. Once we are dealing with a manifest cancer, colon resection becomes necessary. The polypectomy will not suffice. Minimally invasive surgery for colon diseases started in the 90s. So this is now 20 years experience of laparoscopic surgery of the colon and the rectum. Minimally invasive techniques for the colon require a long experience. So the learning curve is much longer as for other diseases like gallbladder or appendix or hernia. However, after 20 years of experience, laparoscopic colon surgery is considered to be very safe and even in parts superior to open surgery. The recovery time is faster, and the recovery to the recovery of the normal life after laparoscopic surgery is much faster than in open surgery. There has been an issue with the indication for malignant colon diseases like colon cancer. But all the studies of the last 10 years have shown that the radicality and the prognosis is equal, if not better, in laparoscopic colon surgery when it comes to treatment of colon or rectal cancer. If it is a resection of the colon, a part of the colon, then the condition will be almost the same as before surgery. The colon is 1.5 meter, about 1.5 meter in length. So if you resect up to half of it, there will be no consequence for the patient. The colon doesn't participate in the digestion of the food. It only absorbs water, in parts few vitamins and electrolytes, but mainly it takes out the water from the stools. So it doesn't really participate in the absorption of food. Therefore, you can resect a major part of the colon without major changes for the patient. However, if you remove the entire colon, which can be necessary in inflammatory bowel diseases like ulcerative colitis, then the stools will be very much more fluid and the patient will have more frequently defecation per day than before surgery.